Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 19th of July. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics. In the United States yesterday, we saw peaking 170,000 positive new cases, with cases increasing 20% over the last 7 days. Hospitalizations have also increased by 20%. And the deaths yesterday had 500 people died yesterday, with the deaths increasing by 9%. Our average death rate now is peaking at 450 people per day. In Illinois, yesterday, we saw 11,000 positive new cases, with cases increasing by 30%. Fortunately, the deaths in Illinois are decreasing by 8%, but hospitalizations are peaking with a 20% increase over the last 14 days. Okay, what can you tell us about this number of deaths, like slowly going up and up and up?
Well, Sophie, the numbers tell the story. And the other thing that's happening is that the numbers are really off, not on hospitalization and death, but on the number of cases. Some modeling studies have been done with the data that is available, and it's very likely that the numbers are 7 times higher, approximately. So it could even be worse. So it's really somewhere around 700,000-800,000 cases per day. That's why it seems like everybody knows somebody who just had COVID. Yeah. That's a real phenomenon, and this is just really spreading quite fast. And the impact is in the hospitalizations and the death. So the hospitalizations are up 20%, and the death rate is now in the 500s. It hit 500. Remember, we were down in the low 300s just 2 months ago. So in the last 2 months, when we were kind of down in this little valley before BA4 and 5 came, it's just been very slowly but steadily increasing. So, when do we do something different than what we're doing? That's a rhetorical question. I would think that it's time to do something now. Not everywhere, not for everybody, but almost over 90% of the counties in the United States are at high risk now. So this thing is everywhere. It's this BA5 that's just beating us up right now. And we've got to be careful. If you're immunocompromised at all, older, underlying diseases, you better be wearing a mask when you go out in public. Not necessarily outside, but out into some other building or room with other people and stuff, especially if they're not masked, which is pretty much they're not masked. I'm actually in Lagos, Nigeria right now, and I tell you that the Nigerians are much more serious about mitigations than we are in the US. It's not everywhere, but I'll go in a room and everybody be wearing a mask. There's people wearing masks kind of everywhere. Not necessarily all the people, but a sizable chunk, whereas in the US, people have pretty much given up on it. But this is not the time to give up, because the virus is not done with us. And we can mitigate the serious disease with the current available vaccines. So get boosted, get your second booster if you're eligible for that. Get your kids vaccinated. That is going to keep the serious disease down, and it's creeping up. So, but our booster rate is really not very good.
No, not at all. All right, Dr. Murphy, now going into our first headline, the menstrual changes after COVID vaccines may be far more common than previously known. Okay, what can you tell us about this new possible symptom of getting the vaccine for individuals who have a menstrual cycle?
Well, this was always an issue. We knew with COVID things changed. Pregnancy is worse. I mean, more complications. And there's a study. It's called the Nurses' Health Study. And 3,858 American and Canadian female nurses with a combined follow-up of over 9 years. So they've been following them, you know, for a long time. And when COVID came along, they were collecting the data. It's a survey type thing. These nurses are enrolled and they get these questions asked to them. And so when COVID came along, they started asking them about COVID vaccines and COVID, actual COVID. So 3,500 people, 3,527 actually had a COVID vaccine, and 421 actually got COVID. And they found, like you just said in the headline, menstrual cycle was longer, a little heavier with after the vaccine. So that's over 3,000 people in that study. That's pretty powerful. Yeah. Now it's transient. It gets better with time, and pretty much gone at 6 months is what they're reporting here. Now, you know, these surveys are not 100% perfect, but I mean, I think this is real, and women should be aware that this change can happen. It's been shown in a nice study like this. The interesting thing in this is that the COVID patients, they didn't see any difference. Now, you only have 421 women that got COVID in the cohort. So it's what they say underpowered, but that doesn't take away about the vaccine data. So, you know, I think women should just be aware, and scientists should be aware to make sure they study this when they do other vaccine trials and treatment trials. You know, is this affecting women's, menstruation cycles and the whole genital urinary system? And you know, we'll see. For transient, there's no impact on pregnancy, no adverse things, no serious effects, but they're real effects.
Yeah, no, absolutely. And then going into our second big headline, which ties closely into, you know, the initial statistics that we talked about, is that vaccine protection has waned this spring, but boosters have helped, the CDC's new report says. So what can you tell us about the need to get a booster shot, Dr. Murphy? Like, should Americans be getting a booster shot right now?
Oh, absolutely. The booster shot, I mean, there's some beautiful studies recently, both in Israel and the United States, Europe, the Italians, and, you know, from the impact of one shot, 2 shots, 1 booster on top of the 2 shots, 2 boosters on top of the first 2 shots. So anywhere between 1 and 4 shots versus no shots, versus whether you had COVID or never had COVID. Almost everybody's had COVID now, so that kind of doesn't make too much difference, except for you, I understand. but it's all been looked at, and the more shots you have, the fewer, at least long-term side effects, serious side effects, not long COVID, but serious side effects are less. So keep up with your boosters. Long COVID has also been shown to be reduced. The data are not as strong, but everyone that's looked at it, boosted people, vaccinated people tend to have less long COVID. So there's just more and more reasons to get boosted. People are tired of it. Oh, I'm tired of COVID. COVID's not tired of us. And if you want to get sick, some people can get really sick, you know, particularly if you're older, you have any underlying disease, please go out and get up to date with your booster shots. Now, in the fall, late, looks like it's going to be late fall. Both Moderna and Pfizer and Novavax have said they're coming out with a revised vaccine, version 2.0. And that will have more direct activity against Omicron. And hopefully that can blunt the numbers of new infections. Because the whole problem with coronavirus is that you don't get lasting immunity. That's like why do people always get the common cold every year? That's a coronavirus thing. That's one of the causes. But, you know, it just keeps coming back and the immunity wanes. So you've got to keep up with the boosters. It's the same thing with flu. Flu keeps coming back every year, no matter how many times you get it, how many vaccines you have. We get used to taking a flu shot every year, a pneumonia virus vaccine pneumonia bacteria, pneumonia shot, pneumococcal shot every 5 years or so. So, you know, it's not that unusual to have to go through this, but if you do keep up with your boosters, you will significantly dampen the serious consequences.
Yeah, absolutely. All right, going into 4 questions for the first one. These individuals say they're in their healthy mid-50s, they're double boosted in early April, and are planning to attend an indoor wedding this coming weekend in a high-risk county with a few hundred guests that they don't know. They aren't planning any COVID protocols, i.e. no requirements for vaccination, tests, or masks. Is it safe for them to attend? / is it safe for anybody to attend this massive wedding indoors with the state of what is going on in this country, Dr. Murphy?
Well, yes and no. I mean, it's a personal decision at this particular point because the public health authorities have basically given up right now. Although LA County may require indoor masking. I saw a headline of that just the other day. The Fed, the CDC, and the government, the central government, looks like they've given up on making these decisions. They've pushed everything downstream to the states and public health departments. And even the public health departments have pushed it down to the companies and the institutions. Oh, you can do it if you want. We're red. We're in the red. Everything is red. In other words, it's high risk. So for these people, they're in their 50s and they're healthy. They're probably going to do well. Now, they should be up to date on their boosters. And if they do get sick, if they're eligible to take it, they take Paxlovid. So that's the way we're going to handle this now. Now, if one of them had an immunocompromised condition, I would say it's probably not good to go. If they just were more concerned, I mean, if you want to lower your risk, you could wear a mask while you're there. People should realize that, should accept people wearing masks if you're indoors at a wedding or some kind of event or something like that. Some people should be, wear a mask. We should just get used to people wearing masks if they want to do it. It's a personal decision, and people shouldn't take anything against them. That's their decision to wear a mask. It's your decision to not wear a mask. That's where we are right now.
Yeah, absolutely. Going into our second question, Dr. Murphy, this is regarding the Moderna vaccine for 5-year-olds. This individual, his daughter who's 5 years old, received her primary series of Pfizer last fall, getting her second dose right before Christmas. And she's due for a booster as a 5-year-old. Can she get Moderna? Can she get Pfizer? Should she wait? This individual's 5 years old. What is the eligibility?
Well, you can check the CDC guidelines, which are kept up to date. I believe the Moderna vaccine is approved for 6 and up. I'm not sure if they got their approval for the 6 months. We'll have to check that. They're waiting for that approval, or it was recently approved. But anyway, the booster shot for younger kids, I think, is only approved right now for the Pfizer, and that's from age 5 and up, if they're eligible for it.
Okay, great. And now for our third question. If this individual tested positive for COVID on June 1st, didn't have any symptoms, can they, I feel like this is a little bit of, we answer this question every week, but if they're tested positive on June 1st, hypothetically speaking, and they had no symptoms, they can be out in the open by June 9th, Dr. Murphy? And when should they get the booster?
It would be June 11th.
June 11th. And when should they get their new booster? Should they wait?
The people are vaccinated?
Mm-hmm.
And they want to know when to take the booster.
Yes.
Okay. So there's no hard and fast rule about when to take the booster if they're eligible for the booster. So assuming that they had their 2 shots more than 5 months ago, they can take it now, or they can take it in a couple months. I don't think they should wait for the version 2 vaccine to come out, because we don't really know when that's going to be, and it might be 3 or 4 months from now. This BA.5 Omicron variant is so contagious. But I wouldn't take it right after you had the infection. So they had got it June 1st. Maybe they could take it in August or September. The only thing bad that would happen is that you would have more side effects from the vaccine. You'd have more aches, pains, maybe a little fever, but they're temporary and they go away in a day or two. I took my fourth shot, my second booster, within 3 weeks, I think, of getting better from when I had COVID. And yeah, I felt that one. That was a good one. But I was planning on going to Africa, where I'm doing a lot of work, and I didn't want to get sick over here. I didn't want to get sick anywhere, but I mean, I didn't want to be far from home and get ill. And I didn't get anything, and I'm still doing okay. But I mean, you just have a greater side effects, but they're temporary.
Great. And now for our last question, pretty similar. This individual tested positive for COVID last Wednesday, had symptoms, and is taking Paxlovid. Symptoms are now gone. They took the last dose of Paxlovid on Monday, and as of Sunday morning, still testing positive on a rapid test. How much longer should they stay in quarantine, and when can they be out and around with people without wearing a mask?
The simple answer is nobody knows. But having a positive antigen test is not good. That means you've got virus still floating around in you. So I would, if you follow the guidelines don't mention getting tested all the time. That guideline would be that you stay in isolation until you are almost completely asymptomatic, and at least 5 days. And then you can go out wearing a mask for another 5 days before you go to, quote, normal. So now this is really a great question that we don't really have an answer. So, but having a positive antigen test, I think, is not good. You have enough virus in you to get picked up on these tests. I mean, I think as long as your antigen test is positive, you should, and you wait the whole 10 days from, when you got sick, and then you're feeling otherwise completely well, but your antigen test is still positive, you should be wearing a mask until that antigen test turns negative.
Okay, great. Well, Dr. Murphy, those were all of our COVID questions. We will see you next Tuesday.
See you Tuesday.
Bye.
Bye.